In our division, traditionally, we've had relatively limited resources when it comes to providing families with information about social work services, community resources, particularly for children with special needs or families that are struggling in various ways. And the Connect to Health program has provided us with essentially real-time access to information about those support services that can be provided to families either immediately during the visit, at the end of the visit, or in some cases by phone afterwards. Up till the availability of the Connect to Health program, we really didn't have that at our fingertips. We could get the help, but it was not as readily available. And honestly, I feel that the program, such as it is, provides a level of enthusiasm and maybe up-to-date information about resources that is really valuable and that we did not have before.
I found that working with Connect to Health, that as a social worker, it was a really easy process. From working to the volunteers with working to everyone that set things up, we were able to identify things from the beginning. We laid out a plan, and then we're in contact to make sure if there needed to be anything adjusted in terms of the flow. But it was really just a nice process where I felt like it was really well organized and we had everything in place. What is so great about Connect to Health is it's a really nice one-stop place where you have families that are in need and are seeking guidance of what to do, and sometimes they feel like they're making all of these phone calls. And so with this, it was one nice thing where I could say, okay, let me get you hooked up with this, and then they were able to call and to help them. And what I also loved is that they follow up. That follow-up piece is a huge piece that sometimes when you're in need and stretched, that they're able to do that. And so they could kind of make sure, all right, did this work? And if not, get them connected with other things.
I always have been somewhat anxious or stressed about my inability to provide families with up-to-date information about community resources. I know those resources are out there. I know there are various websites that can provide me with information, but I'm always questioning, do I have the right phone number? Am I up to date with what's available? Am I accurate with what's available? So the availability of the Connect to Health volunteers, who are, as I mentioned, very much up to date, essentially assuages my fears that I might not be able to communicate that information effectively or correctly.